Good afternoon. This is Adam Falcone from FELDESMAN, Tucker, LEIFER, FIDELL. I'm happy to be with you today. I'm unhappy that I can't be with you in person today due to the coronavirus outbreak, but I'm grateful that AHI has allowed me to transmit some information to you today that I think is going to be very helpful in negotiating and contracting under value-based payment arrangements. I know some of you have heard me before. Others, this might be the first time. I'm part of a kind of a niche law firm that's based in Washington, D.C. We represent many health and human service agencies across the country. We were started as a law firm that stuck up for the little guy, mostly federal grantees, and then our healthcare practice grew out of that. And today we represent many mission-driven organizations, lots of nonprofit organizations that do conduct Head Start programs, Ryan White grantees, community health centers, behavioral health providers, all sorts of what I think are the sort of good guys in health and human services. And we do everything from contract work, regulatory work, to even litigation sometimes as well on their behalf. I kind of fell into this spot because I had a managed care background from working for a nonprofit association representing nonprofit community health plans after leaving the DOJ, where I did some enforcement work in the healthcare space against basically providers that were unlawfully engaged in price fixing activities that were violations of the antitrust laws. And so I do a lot of work with community-based organizations, with community health centers, behavioral health providers, helping them figure out how it's best to contract with managed care entities. And I do a lot of work in strategic counsel and offering them ideas on how to have better contracts and value-based arrangements with those types of organizations. This webinar today is just for educational purposes. My law firm always tells me I have to present this slide. And if you do want legal counsel, then I encourage you to find a lawyer and engage in that kind of counsel advice with counsel. Many community-based organizations, I think they would like to partner if they could with healthcare organizations, managed care companies if possible, and be an input in addressing social determinants of health. But one of the most significant challenges for many CBOs to form these types of partnerships is the time and expense that goes into a contracting effort. So the goal for today's webinar is really to assist you with thinking about how to develop internally the infrastructure with the resources that you have and some of the negotiation strategies that can support your efforts in value-based payment arrangements. So today I'm going to sort of talk about three things. One is how you might think about preparing for value-based contracting activities. Second, I'm going to talk to you about how you evaluate a potential value-based contract and read a contract. And then step three, I'm going to talk about some negotiation tips that I have found helpful in negotiating contracts between different parties. I always start out my trainings, particularly with smaller organizations. I usually start out to explain a little bit about the predicament that I think that you probably feel yourself is in. That is, if you're contracting up against a larger organization, I think many of you think that you don't have any negotiation room or leverage in those discussions. And so I always like to remind people that size isn't the only advantage when you contract or when you negotiate with another party. In fact, big competitors' perceived advantages can often mask significant and even bigger disadvantages. If you think about the large sumo wrestler, he might be larger than his adversary in this picture, but he might have be able to have his balance offset more easily than the little guy. The little guy might be able to run around him without a problem, and the big guy could fall off balance or fall or might not be able to keep up. So just because you're smaller than the other party that's across the table doesn't always mean that you don't have your own advantages, and it doesn't always mean that the bigger guy doesn't have certain disadvantages as well. But one thing I'd like to urge you to think carefully about before you sign a contract or sign a contract amendment is don't feel compelled to sign everything that comes before you, because some of the contracts or contract amendments might not be in your agency's best interest. I have an example from that. Just this past week, a client of mine was offered a contract amendment from a managed care organization, and they were already participating in a value-based arrangement with that managed care company, and they were offered an amendment to participate in a different value-based arrangement with that same MCO. And the MCO pressured them to sign the contract amendment by the end of the week, and they sent it to me to review. And when I looked at the document, what I realized was the MCO essentially, maybe they were in some bad financial times, were trying to get out of the current arrangement and end it early. Because the client was in an agreement with the MCO that they would receive these extra payments through the end of this calendar year. And the MCO, the only way they could undo that would be to provide 90 days notice if they wanted to terminate that agreement. So they came up with a very clever idea. They sent this client an amendment which would remove their current value-based arrangement and substitute something else which doesn't look like it would pay my client anything. So essentially the MCO, by amending the contract and pressuring my client to sign, was obtaining a way to terminate their existing arrangement and substitute something worth really nothing. And so when my client and I discussed it, we basically realized is that the best choice for them was to do nothing, was to not sign the contract amendment and keep the payments from the MCO continuing to come in. And if the MCO really needed to terminate the contract, then they would have to provide 90 days notice to get out of their current arrangement. But at least my client would have an additional 3 months to enjoy those payments before that contract was terminated. So don't always assume just because a contract is offered to you that it's going to be necessarily in your agency's best interest to sign it. So the 3 steps I'm going to discuss today is about preparing, evaluating, and then negotiating. So step 1 is the most important phase of any kind of contract negotiation, and it comes way before even you get the contract from the other party. The first step is really about preparing for the contract and thinking about what your strengths and advantages are and what your objectives are under the agreement or the potential agreement. On the slide in front of you, you see a picture of the battle between David and Goliath. And the New York Times writer Malcolm Gladwell wrote a whole book that was titled David and Goliath. And it has to do essentially with Malcolm Gladwell saying that that Goliath, yes, he was larger than his adversary, and in common culture, it was presumed that it was a miracle, essentially, that David was able to defeat Goliath. And Malcolm Gladwell says, no, we have the story all wrong, that in fact, David had a very, very powerful weapon against his adversary. He carried that slingshot, which usually had a stone in it. And when that slingshot was wound up as it could, it basically had the same power as a gunshot today. And unlike the picture that you see in front of you, David could actually be far or steps away from his adversary. He didn't have to be right up and close next to Goliath. He could be out of harm's way, while Goliath had to basically engage in battle in hand-to-hand combat. And so Malcolm Gladwell's point is that David, though smaller and though he had a smaller weapon, had a very, very powerful weapon against his adversary. And Malcolm Gladwell says there is also some historical commentary that perhaps Goliath suffered from some kind of disease or disorder that made him very large, but also caused potentially some blindness or some eyesight issues. And so potentially David had a lot of advantages going against a Goliath. And so perhaps we should say that it's not a miracle that he was able to defeat Goliath. Maybe he actually had advantages that were superior to Goliath, in fact. And so it should be obvious that he would have won in his battle. So it's very important to know when you're negotiating with another party is what are your advantages? What are your strengths against them? Where are your leverage points? Because the other party is not going to tell you. Or at least they're not going to usually tell you. There are a few instances where I have been lucky enough where I've been able to probe through some gentle questions and find out exactly where my leverage points are. For example, I had a behavioral health client in New York State, and they had a managed care company that came to them and said that they wanted to contract with them. And I said to them, why you? I asked the contract rep on the other side, the managed care representative. I said, why are you reaching out to my client right now? I'm just real curious. And the contracting rep answered that she was reaching out because the only other provider that they had in the network had just notified them that they were terminating their agreement and that they would be basically have a gap. They wouldn't have anybody in their network that could provide my client services, and my client was the only other entity in the county, essentially, that furnished that specific service. Well, when I heard that, I knew that I had leverage. My client had leverage, that the MCO basically needed my client more than my client needed the managed care company. That gives you a lot of leverage in negotiations because now you know you can push harder on things that are important. Could be contractual provisions that you want to see or have changed in the contract. It could be reimbursement rates or whatnot. But now you know that you have a significant degree of leverage over the other party to get the terms that are going to be fairer or better or more advantageous to you because the other party, in this case, the managed care company, really needed my client so that they would not fall out of compliance with the network adequacy requirements for the types of providers and services that they had to provide in their network to enrollees of that health plan. So the first source of leverage that I typically look for as a lawyer is I want to know whether there are legal obligations on the other party where the other party has to contract with me or with my client. Because I know if there are legal obligations on the other party, then I know that essentially it gives me some leverage, that the other party can't walk away if they really need to include my client because it's a legal obligation. Or if there's something that I offer to my client that would make my client suddenly come into compliance with some other requirement that they have. So one of the sources of information that I typically look at, because most of my clients bill Medicaid for services, is I look at whether there's anything under federal Medicaid laws or regulations that basically tips the scales and makes my client valuable to the managed care company. I look at state insurance laws sometimes about in regard to network adequacy requirements, the types of entities and services that have to be provided through a managed care company's network. Most importantly, particularly in New York State, is the model contract. These are the legal agreements between the state Medicaid agency and each MCO that the Medicaid agency hires to provide services or arrange services to Medicaid enrollees. This is often called the model contract. It's a little bit confusing, but the reason why the term model contract, what these contracts between the state Medicaid agency and the MCO is called, is because the states typically put online the model that they use, that is the template that they use, that they sign with each MCO, but not the actual contract that they have signed with each MCO. It's just the model that they're sharing with you. So in common terminology, when you see, for example, in New York State, the Department of Health posts model contracts, that's the template or model that you can presume each of the MCOs have signed in their contract with the state Medicaid agency. And there's lots of goodies typically in that contract. It usually goes on for 200 or 300 pages, but there's typically a whole section on the MCO's contractual obligations in the network that they have to form, the provider network, the types of providers that they have to have in that network, and the terms, in fact, they usually have to include in their agreements with providers. And so, as you might assume, if there are specific terminology in the model contract that is required in the contract between my client and the MCO, then it's helpful for me to know those terms, because now I can insist on seeing those terms in the contract, and I know that if the MCO does not include those terms, they would not be compliant with their model contract or with their contractual obligations to the state. In New York State, there's another document that you don't have typically in other states, which is the DSRIP roadmap, the state's roadmap to achieve value-based contracting. And I'll come back to that in a moment. Lastly, I sometimes look at insurance exchange regulations or rules or policies because that also has some helpful contractual obligations or regulatory obligations that the MCO has to abide by, and that typically can also provide sources of leverage, legal leverage. So let me talk about the value-based contracting requirements that are in the New York State roadmap. As you've probably heard, probably more than you can stomach, the state is very eager to move providers in New York State from fee-for-service payment arrangements, where they're billed, basically bill each unit of service to a payer, to what's called value-based payment arrangements. These are alternative payment arrangements where the provider is paid based on quality or outcomes. And the reason why the state wants to do that is because many policymakers have or believe or have studies that show that if plans were to pay providers or provider groups not simply for services, but really for outcomes, that there would be a shift in the outcomes that are achieved health-wise, that the financing, the way that payment works between the state and the MCOs, that there could be savings to the state, Medicaid programs, by moving away from a volume-based model, which typically incentivizes providers to bill more services, but there's no guarantee that they have better outcomes as a result of those increased services. Higher utilization doesn't necessarily mean better quality outcomes or health outcomes. So New York State, like other states, are looking to value-based arrangements to help save money and to move to achieve better outcomes. So the way New York State did that is they have requirements in their contracts, in that model contract, with every Medicaid managed care organization, where they've set specific targets for value-based payment arrangements between the plans and providers. And if an MCO doesn't meet those targets, there's language that allows the state to penalize financially those MCOs for failing to meet the targets, for failing to have enough value-based payment arrangements. And this has been going on the last 4 or 5 years. And so by next month, under the New York State roadmap, 80 to 90% of the total of provider payments that are being made by Medicaid MCOs are supposed to be in at least level 1, I'll define that in a moment, value-based payment arrangements. And at least 35% of the total of MCO provider payments are supposed to be in level 2 or higher. So what does that mean, level 1, level 2? These are types of arrangements that are struck between managed care companies and provider or provider groups. But let me talk about one wrinkle or one recent shift to those requirements that now brings in CBOs. So New York State updated the roadmap, and they wanted to encourage these value-based payment arrangements to include CBOs and address social determinants of health. And so what they did is now they stated that in order to have a qualifying value-based payment arrangement, level 2 or 3, it must now include at least one social determinant of health intervention and at least one tier 1 community-based organization. And if you don't know whether you're a tier 1, tier 2, or tier 3 CBO, then go to the New York State website to see how those definitions work. Generally, a tier 1 CBO is a nonprofit, non-Medicaid billing, community-based organization, like that one that provides housing or food banks or social services. Tier 2 is a Medicaid billing organization, but provides non-clinical services like transportation. And then tier 3 CBOs are Medicaid billing nonprofits that provide clinical services. So it might be a mental health service or a substance use disorder service provider. And so now, for the very first time, it's now a requirement to include a tier 1 CBO and have at least one social determinant of health intervention in order to have a qualifying value-based payment level 2 or 3 arrangement. So they have put in requirements that now put you in the game if you are a tier 1 CBO. It's a very powerful way that gives you leverage, because now you potentially are needed in order to qualify for these level arrangements. And if the MCO does not meet those targets, they can be penalized by the state. So let me give you an example well, before I go into the example, let me talk about these different levels of arrangements, levels 1, 2, and 3. These are the types of arrangements that are between the plan, the Medicaid plan, and either an individual provider or groups of providers that come together to participate in a value-based payment arrangement. This is not how you will necessarily be paid. So just because you look across this slide and you see these arrangements that seem to involve a lot of risk, taking on a lot of risk, don't presume that you would be paid under a value-based arrangement. Let me repeat that again, because there is an awful lot of confusion, I think, among CBOs that in order for them to contract with an MCO or a VBP contractor, that suddenly they too have to take risk. You do not have to take risk. The MCO and the provider that's in a VBP arrangement has to take risk, or the MCO and a group of providers who are part of a VBP contracting entity, they have to take risk with the MCO in order to have a qualifying VBP arrangement. But that does not mean that you have to take risk as a community-based organization. So before I give you the examples, let me just share with you sort of the quick summary of what these arrangements between plans and providers look like for qualifying value-based arrangements. You will see that on the left-hand side is sort of my shorthand for the arrangement, and then the second column describes in detail what that means. So a level 1 VBP arrangement and level 2, they both involve the managed care company estimating their total costs to take care of a particular defined population of enrollees. They basically set a benchmark or a target. And then they say to a provider or a group of providers, they say, this is our target. If you do a whole bunch of interventions and good care management, and you actually cost us, the MCO, less money because our total claims are below that benchmark, and you save us money, then the MCO will share a portion of that savings back with the provider or the group of providers. So when the MCO shares the savings because the costs at the end of the year were less than the target, and they share that money back with a provider or a group of providers, that's called a level 1 VBP shared savings arrangement. So it allows providers to basically benefit from saving the MCO money because they didn't have as high expenditures. Some providers or groups of providers take downside risk, meaning that if it costs the MCO more than the target because claims exceeded the target, and then the provider or the group of providers owes money back to the MCO, that's called a level 2 VBP arrangement because now there is downside risk for the provider or group of providers. That is, they're penalized if it costs more than the target. That's level 2. Now you might be scratching your head wondering, well, if I'm a provider, why would I ever want to do level 2? Why wouldn't I just want to stay in the world of level 1 where I only have the gain if there's a savings, but not the penalty? That's a good question. And the answer is that in a level 1 VBP arrangement, an MCO might share, let's say, 40% of the savings with the provider, but in a level 2 arrangement, they might share 50% of the savings or 60% of the savings with the provider or the provider group. In other words, by taking on the downside risk in a level 2 arrangement, there is usually a more generous sharing between the MCO and the provider group on those savings. There's a more generous percentage that the provider can earn from the MCO in a downside risk arrangement than just an upside arrangement like level 1. So both level 1 and level 2 are VBP arrangements that involve setting a benchmark or a target for total expenditures based on the total cost of care for a defined population, and a provider or a group of providers has an opportunity to help the MCO save some money and then benefit financially. Level 3 VBP arrangements actually involved a capitation payment. That's a fixed payment that the MCO provides to the typically a group of providers that have formed a value-based payment entity. It's a population-based payment, and it pays for typically all the healthcare services that the enrollees are eligible for. And the VBP entity, the group of providers, now has to pay for all the healthcare expenses themselves through the capitation that they receive from the MCO. So they're basically, they get money from the MCO, and they have to use those dollars to pay all the providers for the services provided to the enrollees. And if they do a good job managing all the services that are being provided, it can result that they owe more money out than they receive from the payer. So it's a risk-based arrangement because they only get a fixed amount, and they have to manage those dollars, basically their budget, manage use of those dollars so that hopefully there's something left over, and that leftover is their profit because ideally it would cost less to take care of that population than the capitation or premium dollars that they're receiving from the MCO. And New York State is encouraging the movement towards level 3 capitation arrangements between plans and providers. So they want to, New York State has a policy where they're trying to shift the risk from plans to providers because there's research that supports the notion that providers are in the best position to manage payment, take the risk for the cost and the outcomes for a population of patients better than an MCO might be able to do on their own. So I said I was going to share with you some examples. Here are 3 examples for how a community-based organization might contract under a value-based payment arrangement. In example 1, you have the MCO, the managed care company, at the top of the slide, and you see wherever you see arrows, that's a contract. So in this example, the managed care company is contracting with a value-based payment contractor, a VBP entity, under a value-based arrangement, maybe level 1, maybe level 2, level 3, but let's assume here that the MCO wants an arrangement that qualifies as level 2 or 3. So they have to also include at least one tier 1 CBO, and they have to address at least one social determinant of health, have an intervention. So in this arrangement, the MCO wants to get credit for that, have a qualifying arrangement, so they contract not only with a VBP contractor who is going to take on the risk of downside risk if it's level 2 because it's shared risk, or maybe they're paid a capitation for all these healthcare services. And you can see underneath the VBP contractor, you have a group of providers that have come together and they participate in the VBP contractor's arrangement. So they are the participating providers. The CBO contracts separately with the MCO to provide, let's say, address one social determinant of health, but maybe housing insecurity, and the CBO perhaps provides an intervention to certain enrollees that maybe the MCO or the VBP contractor determine these enrollees are at risk for losing their housing or don't have stable housing, and they want the CBO to provide some supportive housing services to assist those enrollees to secure permanent housing. And hopefully the CBO is being compensated by the MCO for the services that they're furnishing to the MCO's enrollee. One definition, you may have heard of the term ACO, Accountable Care Organization, or an Independent Practice Association, IPA. Those are terms that describe certain types of provider networks, groups of providers who have come together and form a network. The term VBP contractor is sort of an umbrella term that encompasses potentially ACOs, groups of providers that have formed an ACO, IPAs, the providers that have formed an IPA, or it could even be an individual provider like a big hospital system or healthcare system that has come together and that is taking risk in a value-based payment arrangement with an MCO. But VBP contractor is sort of the neutral term that describes some party that is taking that risk in a contract with an MCO. So example 1, you can see here that you would be participating as a tier 1 entity, CBO, in the value-based payment arrangement, but you are not in this tier 1 example part of the VBP contractor. You are a separate contractor, separately contracting with the MCO. You don't even have a contract with the VBP and contractor under this first example. In example 2, however, the contracting arrangement changes. You still have the managed care contractor at the top of the slide. They contract with a value-based contractor, let's say an IPA, under a level 2 or level 3 arrangement. The MCO wants credit as a level 2 or 3 arrangement, and so they want the CBO, a tier 1 CBO, to participate in the arrangement and address at least one social determinant of health. But in this arrangement, they have let the VBP contractor go out and find the CBO and contract with that CBO to furnish services to certain enrollees of the VBP contractor who, let's say, again, are at risk for losing their housing. So in this arrangement, now the CBO has a direct contracting relationship with the VBP contractor, which again could be an IPA, could be an ACO, or it could just be a large healthcare system, a healthcare provider that wants to contract with the CBO for the CBO's services, whatever they may be. And so you may have two different types of entities that are in VBP contractors arrangement. You have the CBO, and then you also have the VBP contractor contracting with various providers to render healthcare services. In both of these structures, they could comply potentially with the DSRIP roadmap requirements to include a CBO and to address at least one social determinant of health. Just the relationships between the parties are different than in the first example. The third example would also potentially qualify under a level 2 or level 3 VBP arrangement, but again, things have shifted here. In this case, you still have the managed care entity, top of the slide. They contract with a VBP contractor. They also contract with a tier 2 or 3 CBO, or maybe a group of them, which in turn contracts with a tier 1 CBO. So now you have a tier 1 CBO. They don't have a contract with the MCO. They don't have a contract with even the VBP contractor. Instead, they are what I would call, as a lawyer, a downstream contractor, because they are downstream from the tier 2 or 3 CBO. And New York State's Department of Health has said this too would qualify as a level 2 or 3 arrangement, where the tier 1 CBO is part of the deal, part of the arrangement, but they are not directly contracted with the MCO or VBP entity. They can have a subcontract with a tier 2 or 3 CBO who in turn has a contract with the MCO, and that would qualify. The important thing is that the tier 1 CBO is part of the VBP contract arrangement. They're providing some services to the population of patients that are, let's say, identified by the VBP contractor or the MCO as needing those CBO services because it's addressing at least one social determinant of health. Does the MCO have to contract more than one tier 1 CBOs to get credit? No. As long as they have at least one and address at least one social determinant of health, that would qualify. So in areas of New York State where there are multiple tier 1 CBOs within a particular county, you should be thinking to yourself, I might have a little competition. There might be other tier 1 CBOs that also want to get a cut in this, be part of these deals because it can generate additional revenue to that tier 1 CBO. Which moves me into my market power discussion, because market power is another potential point of leverage. An MCO or a VBP contractor in a county or in a situation where there's only one CBO, if you're the only game in town, you essentially have a monopoly on CBO services, then you have a huge advantage because you know the MCO or VBP contractor basically has to contract with you. You're the only tier 1 CBO. There's no alternative CBOs in your market. That allows you essentially to have additional leverage to secure payment terms or provisions in your agreement with the other side. Now, how do you know whether you are the only one? Well, you have to do that work for yourself. Usually you will not be as lucky as I was on that call in my example earlier in this webinar about the MCO contract rep who told me that my client was the only game in town. No, typically MCOs are savvy enough, they won't tell you that. You have to do your own market research essentially and determine whether there are other tier 1 CBOs, other alternatives that the VBP contractor or entity or the MCO can contract with in order to meet the level 2 or 3 definition of a VBP arrangement from New York State. So it's very helpful for you to do a little bit of research and understanding to consider whether there are alternatives in the market, who your competition is, for example, and who you're up against if you want to pursue VBP arrangements with MCOs or VBP contracting entities. Lastly, another point of leverage is often timing. Some of the MCO VBP entities may be under critical deadlines to secure the participation of a Tier 1 CBO by some state-imposed DSRIP deadline to ensure they have a qualifying Level 2 or Level 3 arrangement. So it's often helpful to be aware of potential deadlines imposed upon the MCO or VBP entity. Because as you can imagine, if they're down to the wire, where they're up against a deadline to demonstrate to the state that they have a CBO, then you have a lot of leverage in those negotiations. You know, you probably know from your own personal experience of buying a car, most people are told, if you want to buy a car, you should go to a dealer at the end of the month. Why do they say that? Because they know that many dealers, the salesmen at dealers, have a quota, a monthly quota they have to meet. And at the end of the month, where they're not quite meeting their quota yet, you may have a lot of leverage to negotiate more favorable terms because that salesperson is under the gun. They have to make their quota and they have little time to do it, as opposed to the beginning of the month where they may not be as generous or flexible because they have another 30 days ahead of them to find other potential buyers out there. They're not as desperate. So sometimes timing and deadlines can work to your advantage because the other party has a deadline they're under and they will be more flexible as they become closer to that deadline. So helpful to keep informed of state deadlines, either from the MCO, ask them, when's your deadline for including me or starting this, or listen to your trade or professional associations that keep tabs on these sorts of things, or ask your peers to understand whether there's particular deadlines that you ought to be aware of. In addition to leverage based on timing, market power, and legal or regulatory requirements, it's also helpful to think about whether there's particular value that you can compete on in order to enhance your negotiating position with the other party. Sometimes this is called competitive advantage in the marketplace. Is there something unique about the services that you provide that you can offer to another party to become more attractive than other parties in the marketplace? And so for here, you really have to think about your value, understanding and assessing quantifying the value that you provide and communicating that value. And I think in some subsequent trainings that have been provided by the Helgerson Group, you heard from them about the importance of thinking about your business case or value business case or your value proposition, and that involves thinking about the value that you provide or could potentially provide to a managed care company or to a VBP contracting entity. Let me give you a kind of example of what I mean. Today's healthcare market, when managed care companies are buying services from providers, it's really a flawed market. Most of the MCOs pay or see most providers basically providing the same service of the same quality without being able to distinguish among providers. MCOs, you would hope, would pay more to better providers to reward them for providing superior value, but many don't. They don't have the data, or that's not part of their calculation. Many MCOs, from a contracting perspective, just try to line up as many providers as they can for a particular service area or service and pay them as little as possible. That's the financial incentive that's imposed upon them in a fee-for-service environment. The problem with this model is that basically the buyer, the MCO, has a lot of power and leverage to set payment rates in the way that they want to, which is low, and also the payment methodology, which is often claims-based. Those things don't necessarily work out to the seller's advantage. Most providers don't like claims-based systems. They don't like the frustrations that they have where MCOs deny claims for reasons that they're not quite sure about. It takes a lot of time and effort and staff time to correct claims and resubmit and get paid. It's a big hassle and financial burden along the way. This was the structure that was created by the marketplace that is structured this way. And it's not only in healthcare, but healthcare is the outlier. In other markets where providers sell some service, it's the provider that gets to decide how they're paid and how much they're paid, not the buyer. Once we can stop socially isolating ourselves and can go out to restaurants again, think about the next time you go into a restaurant and then the waiter or waitress presents you with a menu. And if you look over that menu and you see 2 or 3 entrees that you would like, imagine the waiter or the waitress's reaction if you were to say back to them, I'll take these 3 items for, let's say, $10. They will laugh at you, right? Because you as the consumer, as the buyer, you don't get to decide how the restaurant prices their goods or services. The restaurant does. And that's typically how our marketplace works. Somebody who is producing goods or services gets to decide how much they want to sell them for and what kind of payment methodology, what the payment terms are going to look like, not the buyer. But in healthcare, it's the reverse. The MCO is typically deciding we want to pay you fee for service, and this is how this is the amount that we're going to pay you. Doesn't work out well for the provider in this situation, and it often doesn't work out well even for the patients or the enrollees of these plans, because it doesn't necessarily mean that they're getting better care as a result of a provider earning more or providing more services. Hence the reason that New York State is trying to shift the marketplace from fee-for-service to value-based payment arrangements. So how do you fit in? Well, it's important to think about and ask yourself the question is, well, what is the value that I could provide to an MCO or to a VBP contracting entity? Is there, based on the services that I provide, the non-clinical services that I provide, what is that doing for the MCO? If my clients at the CBO have access to stable housing or access to healthier food or other social supports, is it more likely that they will adhere to their prescription drug treatment that manages their chronic health conditions? Is it more likely that they will stop showing up at the ER for services or will prevent certain hospitalizations? Is it likely to reduce the total cost of care? Well, if it is, then you are providing value to the MCO because the services that you render or could render to enrollees can result in some financial savings to the MCO or VBP contracting entity. So I would encourage you to think about, and this is probably not the way that you've historically thought about this, but are there other parties in the marketplace essentially that would be interested in paying for your services? I mean, historically you may have had raised funds to do the services you do through charitable contributions, foundations that have been willing to fund you, and maybe some collection of local and state grant support to support your activities. In the new healthcare world, there may be other parties who would be persuaded that you provide value and that you would provide some beneficial services to their enrollees. So wouldn't it be nice that for you now to have another payment stream that comes in where you may have already would have provided the service to a potential person in your community, but now you're being paid by an MCO because that person is enrolled in a Medicaid managed care plan and the MCO wants to make sure that that person has housing supports or has access to a food pantry or whatnot. And now you are providing a service not just to your client, but also to the MCO who's paying you for those services. So I think one thing I would consider doing as you think about positioning your agency to benefit from some of these changes is to think about how you might quantify the value that you're providing. How much money would you potentially be saving a payer or an MCO or a value-based payment entity? Do you have access to what your impact is on their costs? And how might you be able to get data that demonstrates to them in a very clear way what that savings is? Because health insurance and managed care companies, they like to see numbers. They like to know what they're buying. They like to see the proof that there's some return on investment for their expenditures. So you would want to try to speak their language a little bit and be able to show in business terms, what's the business case for that contracting with you? Well, this is the money that you could save if you were to pay us for these particular services. And much of the data has demonstrated that some experts estimate that 80% of a person's health is determined by non-clinical factors like financial stability, access to housing, access to food, healthy food, social supports. And yet in our healthcare system, unfortunately, we spend all this money, billions of dollars on clinical care that really fails to deliver the health outcomes that we want, because there's these other social, economic, and environmental factors that have much more impact on somebody's health than the medical services themselves. So the Healthy People 2020 approach to social determinants of health, which really these same categories have been adopted by the DSRIP program for social determinants of health, identify these important social factors that can make a difference in these outcomes. So as you look across this list, think about which of these areas you provide services to clients, to consumers, whatever your language is for the beneficiaries of your agency, because you are providing a service. And you kind of have to think about how might I take that service and be able to sell it to somebody else who sees it as a valuable service, a value, and pay me for those services that I'm providing to provide additional payment revenue streams to my organization. And once you figure that out, then I encourage you to think about marketing that service to that potential payer. My advice here is that sometimes you have to knock on the door first. So consider how you might reach out to MCOs that serve your community, value-based payment contracting entities like IPAs and ACOs, and make them know about what you might be able to render to their enrollees who are at risk for certain things like losing their housing or who don't have access to healthy food, and how you might be able to provide some way to help those individuals access those services, because the individuals that typically are most at risk for housing or for food insecurity, they are often the highest cost individuals that are enrolled in the managed care companies and the highest cost individuals that are attributed to these value-based payment contracting entities. And high costs for them mean good opportunity for you to play a role in trying to help reduce those costs. That was all step one. And as you can see, that's the longest and most challenging but interesting step as well, to try to position your agency to have good contracts and understand where your leverage is for negotiating fair contracts with other parties like a managed care company or a value-based contracting entity. Next, we move into step two, which is evaluating a potential value-based contract. And I want to give you 4 or 5 steps that you might follow, actually probably 6 or 7 steps that you might follow in evaluating a potential contract that comes your way. So at this, I'm assuming here that you've gone through step one and that you've been so fortunate that you've actually been offered a contract, and now you say to yourself, oh, what do I do now? So step one is to negotiate sufficient time for reviewing that contract so that you have an adequate amount of time to do your due diligence and make sure that it's a good agreement for your agency. Because maybe the first contract is not going to be a good agreement for your agency. Maybe it's not a good fit. Maybe it would impose too many reporting requirements on you, but not reimburse you enough. Maybe it would require you to hire additional staff to have more capacity to serve the plan's enrollees, but you're not being paid enough to cover those additional costs that you're now incurring. So it's helpful to review these contracts carefully. And the first opportunity typically to negotiate with the other party is to negotiate enough time. And I like this step because it basically allows you to test some of the negotiating that I'm going to teach you in a moment in step 3 early on one simple, narrow, discrete issue, which is getting enough time to negotiate the contract. So for example, that example I gave earlier at the start of the webinar, where my client was offered a contract amendment, the MCO was saying to my client, you need to sign the amendment by, and I think they gave 2 or 3 days to sign the document. So basically high pressure tactics, you must sign this contract by X or you lose it. That's what the MCO's position was. Now we pushed back on that and eventually got another 30 days because we negotiated with that, because we needed to make sure that we had an adequate time period to review that contract. And as you know, we reviewed it and considered it, and we are not moving forward with it, but we needed to buy ourselves some time to do that additional review. So the first chance to test out your negotiating skills and strategies is to negotiate an adequate amount of time with the MCO or the other party so you can do your due diligence in reviewing the document. And some clients are a little bit hesitant to push for having enough time, and I'd encourage you to sort of rethink that, because no party looks bad by asking for additional time. In fact, you look good for doing so. If the MCO realizes that you need more time because really any prudent business party, business would want adequate time, then you just look good in their eyes because you've stuck up for your rights essentially, and you've shown them that you are a competent provider and that you need an adequate period of time to do your due diligence on the agreement, and you're simply just not going to sign every contract. So it kind of throws sort of shows that you are competent, that you're not going to be run over and agree to everything that the other side is offering to you, that you're going to do your due diligence. So I encourage you to ask for enough time that you need. Some agencies I find do have access to outside counsel and they want them to review it. Others have outside financial consultants they want them to review the document. Others want their board of directors to review these contracts. And so you probably have your own culture and history for who has to review contracts that you should comply with. So you have to negotiate enough time for all those steps. Step 2 is to assemble your sort of internal contract review team to figure out who within your staff are the right people to review this document. And I encourage you to think about sort of the operational departments or groups or people that will be affected by this contract, and then make sure you bring in that expertise into the group that you're having to review the contract. So you may have a senior executive or an executive team group that can often be the logical group to share that contract with because it brings in the department heads at your agency. You might have additional folks that you think should review the document because they are sort of in the trenches and would be affected by this agreement. It's up to you to decide sort of the proper cast of characters to be on your team. But I do encourage you to appoint at least one person to be sort of the manager for that team. And also think about who is going to be that same person is going to be your liaison to the other party as the negotiator for that contract. So I've worked with a lot of different agencies, and sometimes they will actually just carve up the contract in that group so that different people are responsible for reviewing different parts of the contract. And that's fine. So they sort of have assignments to each person, and then people have to come back together and talk about what they found when they reviewed the contract, so that nobody actually has to read the contract from cover to cover, except probably your lawyer, but you can divide up the work internally so that each person's expertise is utilized in reviewing the document. Step 3 is assembling all the documents that are relevant for the agreement. It might sound obvious that you would want to be reviewing the entire document when you review the document, but sometimes some of the MCOs or other parties will leave things out. I don't think intentionally. I just think these are often complicated agreements that can go on for many pages with a lot of moving parts, and sometimes things get overlooked. So, if there's a reference to exhibits A, B, and C, and when you get the contract, you only see exhibits A and B, that's a problem. You're missing one of the exhibits that should be part of the agreement. Sometimes these documents have appendices or addendums, whatever the terms they might use. Whenever there's references in the base agreement, make sure you sort of skip to the back end and see whether that particular appendix or exhibit is indeed attached to your contract. Because I've had many situations where I get a contract from a client and it's missing, a particular exhibit, like the compensation exhibit, and the client hasn't realized it, and then they have to go back to the other party and say, oh, by the way, we don't have this particular exhibit. So you kind of want to do that as early on and not just sit on it. You want to make sure and do a check that you have all the applicable exhibits, appendices, and addendums in the document that you receive from the other party. In addition, some of these contracts will incorporate by reference or cite particular manuals or policies that the MCO has that you have to comply with, or it might refer to different state laws or federal laws that you have to comply with. I would encourage you to think about identifying those other documents, because whenever these other documents or laws are incorporated by reference, it's as if they're part of the contract itself. So it's basically you are agreeing to do whatever these other documents say that you have to do. So they are just as important when they're incorporated by reference as the actual document contract you receive from the other party. So in order to know what those documents say you have to do, you have to often ask for them. So sometimes we have to go back to the MCO, for example, and say, your contract references that I have to comply with your manual, maybe your provider manual, but I don't have that. Can you please, send me a link to your website so that I can access your provider manual so I can look at some terms that I'm concerned about to see how I'm supposed to submit claims for reimbursement, or what your credentialing policy is, or what your prior authorization requirements are, so I can review them right now. So make sure you also have anything that's cited, referenced, incorporated by reference in front of you when you're reviewing the document. Step 4 is to think about really who you're contracting with and whether they, what their operational performance is like, sort of what their reputation is. Consider what their past performance. Do they have a reputation for paying their partners on time? If they're an MCO, do they have a reputation for denying an unreasonable amount of claims? It's okay to consider their past performance when you review a contract. And it's important because not only does that give you some insight on what they're likely to do, but it also can help you think about what provisions in the document do I need to shore up, knowing that they're not so good in a particular area. So for example, if they pay a lot of claims late, then it might make you think about whether you should ensure or press to include some provisions where they have to pay you interest on paying you late, as a sort of remedy that you would have against them because you expect that they're not going to pay you on time. So thinking about the other party's performance or operations and what their shortcomings are can help inform you in your review of the actual contract. The other aspect to think about is whether they have money in the bank, whether they have a weakened financial position or not. I like to say if the MCO or the other party that's paying you runs out of money, if they don't have money, then you don't get paid. So the other side's financial position can be important in thinking about whether you want to contract with another party at all, or what you want to do to minimize the risk that they're going to go belly up or bankrupt and basically not pay you for whatever services that you provided. I had a client that had had a contract with a Medicaid MCO, and that Medicaid MCO went belly up. They went into bankruptcy. The client got pennies on the dollar for every claim that they were owed money on. And once they went, the MCO went into bankruptcy, they actually had no way to terminate the contract, so they had to continue seeing patients of that MCO and new enrollees from that MCO, and knowing that they were never going to be paid whole because that MCO was now in bankruptcy. And eventually it left the market, the Medicaid market, and that client couldn't get out of the contract. They didn't have a clause where they could terminate the agreement when the MCO went into bankruptcy, so they were stuck in the agreement for a very long time. Step 6 is reviewing the documents, reviewing the contract that you're offered. I'm a big fan of the Alice in Wonderland stories. Lewis Carroll, I think, has some very creative lines. One of his lines from one of the Alice in Wonderland stories has to do with the White Rabbit. The White Rabbit puts on his spectacles and says, "Where shall I begin, please your majesty?" And the king responds, "Begin at the beginning and then go on until you come to the end, and then stop." Contracts are one of the things where you don't want to follow the king's advice and necessarily start at the beginning of the contract and then keep reading until you reach the end. I suggest that you read a contract much like I used to read the Sunday newspaper as a kid, and I used to pick out which sections I wanted to read first and start with that. Maybe you even do that today. If you want to read the comics first, or read the insert, the ads first, or you want to read the op-ed page. Just like that, you can read the order of the contract is up to you for how you read it. And as you might imagine, there's good reason to do that, being that sometimes all the good stuff is tucked at the end of the contract. Most of the time, the payment terms and the scope of services is actually defined in agreements that are at the back end of the contract. So when I first receive a contract, I typically flip through to look at the exhibits first, because once I know what the scope of the agreement is, what services are being rendered by my client or requested to be rendered by my client, and I know what the payment methodology is, then that context helps me actually understand the terms of the contract itself. In addition, from reading a lot of managed care contracts, I know that typically the first section in many agreements are definitions. And that might be true in a lot of different types of contracts that your agency receives. Well, in my view, definitions don't really make a lot of sense if they're read out of context, if they're just read in the abstract. I find it much more helpful to actually read a definition when that term is being applied and used in the body of the agreement itself. And what you will notice is that when terms are defined in the first section of a contract, they are typically capitalized. And when you thereafter read a term that's capitalized in the rest of the agreement, you should know that, oh, that's a term that was previously defined in section 1, where we have the definitions. So what I typically do is I skip over section 1 for the moment, and then whenever I encounter a capitalized term, that's when I refer to the definition section and read that term in the context that it's being used. So you can review the contract in whatever order makes sense to you, however you want, and I encourage you to kind of skip around and do it in a way that makes sense. The second thing to think about is, do you really understand what each term means? Some contracts are very well drafted, and the lawyer realizes that the person who actually has to follow this contract is not going to be a lawyer, and it's written in a way that's clear, unambiguous, and is understandable by the parties. If it's not, and you need to hire a lawyer to understand what a provision means, if you have some dispute with a client, that's not the best situation to be in. I think it's far better to have a contract term not be ambiguous, be understandable, be clear, so that you can read it over and understand how it applies in a particular situation. So you should be on the lookout for provisions that simply just sort of don't make sense to you, where you can go back to the other party and say, what does this mean? Can we clarify this? You also want to think about the provisions, once you figure out what they mean, is whether they disadvantage your organization. If you're an agency and you receive this contract that is drafted by the other party, you should assume that it's drafted in the other party's favor, that it's not to your advantage because it wasn't written for you and you didn't pay for it to be written. And so some of these terms, they may look sort of innocuous on the page, but they could be not great for your organization because of some legal reason, because it could impose some financial penalty on you, because there could be some disadvantage clinically or operationally, some disadvantage as a result of how that term was drafted. So you want to be identifying potentially terms that disadvantage your agency in some way. I already mentioned the importance of having your responsibilities clearly stated so you can comply with whatever they are. You want to make sure it includes all the relevant appendices and exhibits. If there's anything incorporated by reference, policies and procedures, you'll want to often take a look at that. If you are required particular references to statutes or whatnot, you want to make sure you know what they say. And at the end of the day, you want to make sure that signing the contract makes sense, that it reflects essentially sound business judgment. Because if the contract is not good for your agency and it puts your services at risk or jeopardizes the viability of your agency, it may not be in a good agreement for your agency to sign. Even though there's some upside, maybe the downside is too great to bear and you should take a pass. So one of the most important things to set you up for negotiation is to be thinking about which are the most important issues you want to negotiate with the other party. A rookie mistake to make in any kind of contract review is to go through the entire agreement, whatever its length, and identify 40 to 50 things you want changed, and then send it to the other party. Why is that a bad idea? Well, number one, if you do that, one risk is that the other party simply ignores you. You just look like you're asking for too much and it would take too much time to negotiate with you. So they just basically say, I'm going to put this aside for another day and not ever get back to you. That's one reaction it could have. Or reaction two is that maybe they give in on 25 of the changes that you want and not the others, and they send it to you and you say, well, that's great, but you actually didn't change the things that are the most important to me. And the MCO is going to say back to you, well, you never told us which were the most important things to change. And we, made 50% of the changes that we requested. It's a little bit hard for you at that point to deny that and say, oh, I don't like that. So the most important thing is to make sure you're negotiating up front and as early as possible the most important issues in the agreement, the types of issues that if you can't get changed, that you may not sign the contract. So I would encourage you to work through that group that I talked about, that internal group, and once each of you has sort of done your homework and identified potential issues, to discuss which are the key critical issues that if they're not addressed in the negotiation, that you may not proceed with the agreement because the risks just are unacceptable for the organization. The second set of issues may not be those critical issues, but they might be, if you will, yellow issues, significant issues that you should address prior to proceeding because they create undesirable risks. So this is not about risks that are unacceptable, but that's just merely undesirable risks for your agency. And then the next set of issues could be green. Ideally, those issues that would be addressed prior to proceeding. And if you go through the issues that you've identified and you flag them red, yellow, green, now you will have a hierarchy. You'll be able to prioritize the most important 5 or 6 issues that you want addressed, and that's where you start. So you don't send all the issues over to the other side at once. You say, no, there's 5 issues I want to talk to you about. Those, of course, are going to be your most important issues, and you negotiate through those first. You do not forfeit the right to come back later once you've negotiated those issues to the yellow issues and the green issues. Now you can say to the other party, great, we've dealt with the hardest issues. I have a few other issues that I'd like to discuss with you, but these are probably not going to be a big problem for you. And ideally, we'd like to get these resolved too. And you go through those. And then when you're done with those, you can proceed on to the green issues if you have some more issues, things that are that you'd like changed to reduce some risks. So it's important to prioritize so that you're in a better negotiating position. So you're actually negotiating about the things that you really care about first. It doesn't make sense to waste time negotiating the yellow or green issues if you can't negotiate or you haven't negotiated the critical issues facing you. Last, I'm not spending any time really in this webinar talking about specific contract terms that you're likely to encounter because we don't have time for it today. But I wanted to highlight one term that will definitely be in your contract that you ought to start thinking about, and that's the reimbursement terms. There will be some mechanism that the MCO or value-based payment entity reimburses you for what you are doing for them. And as I mentioned earlier on, this doesn't have anything to do with level 1, 2, or 3 value-based payment arrangements risk. You are not taking risk for a population. That has nothing to do with how you get paid as a CBO. You have the flexibility to decide, negotiate with the MCO a payment arrangement that makes sense for how you do business. You may decide that the right way for you to be reimbursed is based on your costs. Maybe that's how you do business. Foundations fund you and reimburse you based on a portion of your costs. Maybe you have other entities that basically pay you at cost, and you want a cost reimbursement agreement. So you'll do these services, and the MCO or the other party will pay you based on your costs for doing those services. That's cost reimbursement. Alternatively, maybe you want a fee-for-service contract where you're reimbursed basically under some fee schedule for each service. So this anticipates that you can sort of divvy up different discrete services that you can offer and that you want to attach a fee for each of those services, like a fee schedule, and that is the fee that you would negotiate with the other party. Or perhaps a case rate makes best sense. A fixed fee for some bundle of services that you offer to each person, because maybe you can't really split things up fee for service. Maybe you can do best by just having a bundled fee, a group of services or a daily rate. It encompasses a lot of things that you do. It's a flat fee. You get it each time you see a person that fits into some description, some case. That's the amount you get. Or maybe you do want a capitated arrangement where you get a monthly sum per member per month for each person that you have to do something for. That's a capitation arrangement. There's some predefined scope of service. Every month by the 5th, you get dropped into your bank account a fee for each of those persons that you are responsible for providing that scope, and that is the amount of money you get. You don't get any more, and you have to figure out how to pay the cost that you incur for that scope of service from that predefined monthly lump sum. And you may look over this list and find that there are other payment mechanisms that you want to negotiate, other methodologies that's not on this list that make sense for how you do your business. But you may never have had to basically decide for yourself. You may have not been in a position before where you've had to figure that out because maybe the other party was always telling you they would how they will pay you. In this case, this turns it around and you get to decide proactively, how do I want to be paid for the services that I'm rendering for the other party? What makes good sense to me? And figure things out. And you may not know, or maybe these things change. Maybe today you say, today I want to do cost reimbursement because that's familiar to me. Maybe in the future I want to move to one of these other payment methodologies because now I'll have a basis to figure out what my fee should be because I have now costs and I've been able to track how much it costs me to deliver a particular service, and now I want to move to a fee schedule methodology and use that data to develop the fee schedule. So you may think of this as somewhat of a continuum, if you will. You'll start at one level, and maybe in the future you'll move to a different methodology. But that's going to be decided between you and the MCO or you and the value-based contracting entity. Step 3 brings us to negotiation. And I like this slide because I think many of us sort of have a, negotiation basically has a bad rap in our society. And it's used, people think of it as combative or aggressive because we see that kind of negotiation happen a lot. But it's really not the only kind of negotiation. I like that style of negotiation. I encourage you to rethink or reframe negotiation simply as a discussion by two persons or two parties, and the goal is to reach agreement. The goal is not to bully each other up and hurt each other and cause resentment. The goal is actually to reach some discussion and reach some agreement on how to move forward. And so think of your negotiation with the other party simply as a discussion for reaching agreement. One of the best books out in the market is called Getting to Yes, Negotiating Agreement Without Giving In. It's available for just a few dollars, I think, on Amazon nowadays. It's in its third printing. It's a few dollars if you want to buy a used copy. Certainly you can buy new copies as well. But it's been around since, I think, the 70s. And it was written by a group of Harvard law professors, and it involves basically negotiations in different types of contexts, everything from car to, international affairs. And they give you some tips and ideas for how you might negotiate. And a lot of the tools that I use and the strategies that I use come from when I read that book many years ago, and I apply them in practice today. And as you can see from the cute kid who's on the slide, my daughter, she's already learning about getting to yes strategies, and she's a very effective negotiator. She gets her way, gets to yes very quickly in negotiating. So let's talk first some logistical questions. What should negotiation look like? Well, the first question to figure is to figure out who is going to be on your negotiating team. Is it going to be a team, or is it going to be a single individual? If you have ever had a job interview where you had multiple people firing questions at you at one time, I imagine you didn't like it very much, that you kind of felt a little bit defensive. That's what it feels like when you have a team of negotiators. And so if you are negotiating a contract with another party and they have one or two people on their team, and you come in with 4 or 5 people on your team, it may have an effect on the negotiations. It might chill some of their discussions with you. They hold things back. They could be intimidated. They may not be as forthright or forthcoming with information that could be critical for you to understand where your leverage is and to negotiate agreement. So I usually advise clients that they should definitely not have more people on their side than the other side does, and I encourage you to think about having 1 or 2 people top as part of your negotiating team with the other party. And most of the contracts that I negotiate, even with MCOs, the MCOs typically have just one, maybe two people on their side on a phone call, typically, not more than that. They don't usually have an army of people. Also think about how it will be negotiated. Is it going to be in writing, by email back and forth? Is it going to be by phone calls? Is it going to be in person? Probably not in person right now due to the coronavirus, but it probably will be either writing or phone call. I would urge you strongly not to try to negotiate in writing. Why is that? Well, if you've ever had an argument with somebody or a loved one by email or by texting, you probably know how it goes. It doesn't work out so well, does it? Sometimes you talk, or often you talk past the other person. You don't really hear them. People misinterpret what you mean. It's much more effective to have a negotiation by phone or in person, where there's real-time communication. You can read, if you're lucky in person, you can read body language, but by phone, you can interrupt, you can hear their reactions to what you're saying in real time, and avoid some of the miscommunications that might occur in writing. I think email is a great device to set up a phone call for a negotiation. You can outline the specific provisions or matters or issues you want to discuss, set up an agenda, and to trade some ideas for potential language that would resolve an issue. But the actual negotiation, I encourage you to have through a phone call or in person with the other side, because it can be the most informative to help you reach agreement. A very common error in negotiation is actually parties that take extreme positions and then hope to kind of whittle it down to the middle at the end of the room. I would discourage that approach. You may see sometimes in negotiations between different parties where one party does kind of take an extreme position and then eventually moves to the middle. What's the downside of that? Well, one downside, of course, is inefficient. Sometimes it takes a really long period of time to kind of move from an extreme position down to the sort of middle ground. Sometimes the middle ground doesn't exactly serve the interests of you or the other party. You can sometimes overlook potential areas of agreements or solutions by taking extreme positions. Let me give you an example from the Getting to Yes book. In Getting to Yes, they describe a sort of a story where a librarian is seeing two patrons argue very loudly, of course, as well. One patron wants the window open all the way, and the other wants the window closed. And it seems like even in the middle, it's, with the window open halfway, doesn't seem to be satisfying either patron. So the librarian comes over and says to the first patron, why do you want the window open? And the patron says, well, I want it open because it's very, very stuffy in here. And she says to the other, why do you want it closed? And he says, well, because it's very drafty in here. So she stops, thinks, pauses for a moment, then walks to an adjacent room and opens the window. Allows enough fresh air into the room, but it doesn't create a draft for one of the patrons. So this example in the book, the example is that this example actually addressed the underlying issues by the two patrons. She found a solution that met their needs, and the solution was not opening the window halfway, because that did not address their underlying needs. And why is that important? Because one of the best negotiating strategies is to figure out what the interests are of each of the parties, the underlying interests. One of the shortcomings that you probably have found in reading over a contract is that just because there's a provision in the contract doesn't give you any insight why that provision was included in the contract. What interest of the other party that was trying to protect. Contracts don't come with footnotes typically. They don't say, hey, I'm putting this provision in this contract because I'm concerned that you're not going to pay me on time. No, they don't specifically say that. They don't come with footnotes. So the only way to learn why parties have particular provisions in contracts is to ask them. And so the best way to really negotiate as well is to ask a lot of questions, because you can start to understand the other side's perspective and what their interests are. So one of the best strategies I use in negotiating contracts with another party is I ask a lot of questions to figure out what their underlying interests are. Because if I know that if I can understand what their interests are, then I think I'm confident enough that I can come up with a solution that addresses their interest, but also protects my client and finds a way to draft the language that also protects them in the process. So having the information by asking questions gives you ways to respond to their concerns through possibilities, different possibilities that are not exactly currently reflected in the contract document. You can be the creative one to come up with a solution that, and you can say back to them, well, if you're interested in this, you're concerned about this happening, this provision will help you prevent that issue from happening. This is how I propose to address it, while also protecting yourself in the process, because the other side's way to address it might have been too draconian and might have really harmed you if that was the agreement in the contract that you signed. So some final suggestions for tips in negotiating contracts. Number one, don't assume that the other party knows your business or knows your concerns or knows your interests. It's a little about a bit of education. So if the contract harms you or a provision harms you in a particular way, it's very important that you explain to the other party why it does so, because they likely will be oblivious. Not that there's anything wrong with them not knowing, they just don't know. It's not their perspective, and it's not in their business to know. Number two, do ask a lot of questions rather than statements when you have particular concerns or when the other side is making concerns, so you can fully understand where they are coming from. Number three, think about being the creative one to develop options that will work for both parties. Number four, think about some objective standard that you want to be used in the contract. Sometimes arguments from fairness make sense. I see this provision protects you, but why doesn't this provision also protect me if we encounter that same situation? So basically you're arguing to them, in order to be, the objective standard that you want is fairness, each party to be treated the same under like circumstances. So the more you can find objective things, this is not how people in this business, in the marketplace contract for this kind of service. That's not typical. The standard thing is doing X. The more you can link your request to what is currently being done or what is standard practice or some objective measure, usually a stronger argument you can make. And then lastly, it never hurts anybody by stating the importance of wanting to develop a good ongoing relationship with the other party. It sounds a little bit Pollyannish, but nobody has ever been harmed in the contract negotiation by telling the other side, we really want this contract to work out. We expect to be a good partner for the next, 3, 4, 5 years. We hope we can grow and do more and more work together. We think we are well suited for each other. Let's really work hard to make this an agreement, work for both sides and both of us. And that often it comes over very well. What do you do if you can't resolve all those red critical issues in your agreement? Well, then you have some hard choices to make. You may have to think about whether this one agreement, this one contract, is really essential to your strategic plan or your business operations. Obviously, if it is, then that's a different scenario than if this is just kind of frosting on the cake and could be a plus, but is not essential. So you have to think carefully about how badly you need this contract in order for you to stay in business and stay financially viable. You also need to think about whether the risks of contracting outweigh the risks of not contracting with the other side. Does the contract create more risks, more good than bad? There may be ways in the agreement where you can actually deal with bad events if they were to occur. So you may decide, I'm going to sign this contract, but I'm going to build a language so that if they do become a bad payer and don't pay me on time, I couldn't get them to pay me interest on late payments, but I negotiated a term that would allow me to terminate the contract early before the term ends. So maybe it's a 1-year contract, but I have the right to terminate without cause. I can just terminate the contract early and get out of it. So I have inserted, or I have a game plan for what should happen to address a potential risk under the agreement. Lastly, maybe there's other ways for you to get a contract that's better. There's a number of provider networks that have formed, IPAs that are formed, even CBO IPAs that are under consideration for formation. Maybe being part of a larger contracting group would allow you to benefit from that negotiation activity and get a better, more favorable contract agreement with potential parties. So a few last thoughts to leave you with today. And what I've heard from many CBOs is that they have not had a lot of existing relationships to support their contracting activities. Many CBOs seem to be under different or disparate regulatory requirements. They distrust some of the COs or big health systems from their experiences of being in PPSs that have not always gone well. So there could be some resentment that has built up. I think you have to put all those experiences behind you moving forward, but also learn from those experiences. So for example, if it turned out that you were paid in some mechanism from a PPS or another party where it didn't pay you in full because you didn't adequately consider your administrative costs or the overhead or the data reporting burden that it was on you, then when you contract next time with a VBP contracting entity or an MCO, do make sure you're more realistic about the costs that you incur as an agency in furnishing whatever services that you render. It's not just the client interaction costs that you incur through people who are on the front lines, but maybe you have additional overhead and administrative and management costs that you need to incorporate in your payment models with the other parties. Do think about investing time to develop a relationship. Many contracting arrangements take many years to develop because trust is involved between the parties. And so sometimes you have to take the time to develop or try to develop those relationships, and you may decide along the way after negotiating, going back and forth, that it's just not going to work out, that you don't see eye to eye, that there isn't trust between the parties, that you don't feel that the other side is looking out for you as much as you need them to be, and that the terms of the agreement are not helpful and create too much risk. And you need to walk away from some partners because they're just not the right fit for your agency. The other thing I want to leave you with is think about it's okay to start small. That it's okay to let's say there's 4 or 5 MCOs that serve your counties where your clients are enrolled in. Doesn't mean you have to have tomorrow contracts with all 6 MCOs. You could decide, you know what, let's just get one done. Let's just find one MCO that makes a good partner. Let's reach out to them to be their tier 1 CBO in their value-based contracting arrangement and get this deal up and running and learn from it. And then if we do well under it, want to grow that business, then maybe it's time to reach out to some of the other MCOs in the community and develop similar relationships with them. But you don't have to do all of them overnight, and you can be strategic about thinking about which MCO you want to approach first. Well, this is normally the end of my webinar where I would take questions from the audience, but this is a recorded webinar, so I can't do that today. But I want to thank you for spending the last hour and a half with me, and I hope the information was useful. If you do have questions, you're certainly free to reach out to me for more information. But thank you and have a good day.
Thank you, Adam. I think that